Did you know that heart disease is the #1 killer of all American men and women each and every year? And did you also know, ladies, that heart disease kills more women than breast cancer and all other cancers combined? Today, we're going to learn about that and what you can do to become heart smart. Hi, and welcome to LifeWorks PRMC. I'm Roger Fallabout, the Director of Community Relations at Peninsula Regional Medical Center. And joining us on the program today is Caroline Farrell, who is an exercise physiologist at PRMC. And Caroline, welcome to the show. Great to have you here.
Hi, thank you for having me.
We love to start the show by having our guests tell our viewers a little bit about themselves. So why don't we take a couple of minutes to learn Caroline's story?
All right, I'm from Cecil County, Maryland. I actually was born in New York, but grew up in Cecil County. I moved there when I was 5. Grew up in a very rural part of the county, lived up on horse farms, never had a neighbor until coming to college here at Salisbury University. I actually transferred my junior year and liked it so much that I ended up staying to get my master's degree as well. Left for a couple years after college, was kind of bouncing around Maryland to find the right job until I ended up back here at PRMC and am now living in Berlin.
Excellent. When did you know that exercise physiology was going to be your chosen career path?
To be honest, I guess I probably didn't. I probably accidentally fell into it. I had an undergrad degree with biology and psych and knew that I wanted to do something clinical but wasn't quite sure about a nursing program or not, and I stumbled upon this program, the Applied Health Physiology program at Salisbury University, and realized they had a clinical track that would give me some hours to work with actual patients and give me the experience I needed.
Is that a 4-year program?
My undergrad was a 4-year program, grad school was a 2-year program.
Got it. Anyone else in your family in the medical profession?
I don't think that there is a single person, close or distant cousin, that is actually in the healthcare field. So I think I'm the only one.
You are the trailblazer, as they say.
I am.
What does an exercise physiologist do for those of us who aren't quite sure what your profession is?
Sure. And in my particular experience, what I do is I work with patients who have some kind of heart disease or pulmonary disease, and we take them after whatever kind of event they've had, and we first start working with them right in the hospital, and we start working and educating them on lifestyle changes, things that they can do to adapt their life to this newfound problem that they may have, or maybe it's a heart attack or a pulmonary disease that they're learning to live with. And we prescribe them exercise the same way that a doctor would go ahead and prescribe medication if you were to fall ill. And we do a developed program for each individual person. It's different. The initial program starts out, it's a 12-week program. We come up with an exercise regimen. We usually start small, then build on it, but it does a lot of education for diet and things that you can do throughout your life, maybe not right there with the exercise, that can help get you better from your newfound disease.
As we mentioned at the beginning of the show, heart disease is the #1 killer of men and women here in America each and every year. So what are some of the risk factors for heart disease?
Starting with something as simple as family history. Being obese puts you at higher risk for heart disease. Having high blood pressure, high cholesterol, living a sedentary lifestyle, a poor diet overall, diabetes, if I didn't mention that, and then age. As you get older, you're at higher risk for heart disease. Usually over the age of 55 is where your increased heart disease problems start to come up.
Modifiable and non-modifiable risk factors. Can you tell us the difference in those?
I could. Modifiable risk factors is going to be, my favorite example would be to use family history. That is not a modifiable risk factor. There's nothing you can do about your family history. A modifiable risk factor is going to be something like your diet or the sedentary lifestyle. You have a choice in those things and you can change them. Blood pressure is even a modifiable risk factor. There are medications that we can use to help control that. So as long as you're compliant with what your doctor has prescribed, it is able to be controlled. So that would be the difference in a modifiable or non-modifiable risk factor.
Sure, and you mentioned medications being one of those things you can do to lower the risk of heart disease. What are some other things that we can be doing?
Overall, your lifestyle is going to be one of the best things that you can do for yourself to lower that risk. Like we said, family history is not something that you can change. So being active, promoting a healthier lifestyle, making good food choices, being aware, knowing your numbers, knowing what your blood pressure is, knowing what your cholesterol is. And although we can't change things like family history, being aware, asking those questions to family members, and then relaying that information to your doctors so that they can appropriately assess you as you get older, and that would probably be the best thing that you could do.
Let's talk heart attack too, and some of the signs and symptoms of heart attack.
Sure, absolutely. I think the number one thing that we are all used to hearing is chest discomfort. I have some kind of chest pain. This type of chest pain is specific because it's going to last longer than a couple minutes, but it could also go away and then come back again. And sometimes it's hard to tell the difference between that and maybe something that's more muscular, which would also feel like chest pain. So sometimes it can be associated with shortness of breath, nausea, dizziness, fatigue, things like that.
Should I experience any of those, what should I be doing? Should I try to drive myself to the emergency department?
I do not suggest that you do. I think that you should immediately call 911. If you're questioning at all that you may be having a heart attack, it's better safe than sorry. Not only is it safer for you to call 911, but it's safe for other people on the road for them as well.
Absolutely. Symptoms and signs of a heart attack, different in men and women?
The big one is still going to be that chest pain, but I think it's important for women to know that there are some different signs and symptoms in them that we typically hear. We most often hear those signs and symptoms for men. A lot of times those are the ones you see in commercials, you see publicized. So women still could have that chest pain, but it most likely will be either paired with, or you may not even have chest pain, you may just have that shortness of breath. You may have jaw pain, which is something else we typically hear, but it can also be felt as back pain. And in women, it may be felt as back pain, and sometimes we don't first associate that with signs and symptoms of a heart attack. So it's good to be aware that we could have slightly different symptoms as a woman, but they're still just as serious and should be taken seriously.
Speaking of women, we have a very robust women's heart program at PRMC, and I know that you're involved in that too.
Yeah.
So what can you tell us about that?
Yes, I'm very proud of our Women's Heart Program here at the hospital. That is something that is given by the Guerrieri Heart and Vascular Institute, and it's funded completely by the hospital's foundation. So it is free to women in our community, which is excellent. We offer these screenings twice a week, all year round. They are full comprehensive screenings. They typically last about an hour. You come in, you get everything from blood work to an EKG done. We do different measurements. We talk about body fat percentage and grip strength, flexibility. We do an osteoporosis screening, screenings for peripheral artery disease. It's a very well-rounded exam. But the great thing about it is we get all those results right there in the office during your exam time and are able to talk about all them. So it's a really good educational program. We're able to sit down with women and talk to them about what these numbers mean, and then show them norms and averages and where they fall compared to that, whether it's based on their age or their sex, and then talk about whether they're better or worse than maybe what some of those averages are, and then changes you can make to kind of find yourself in that average range. And we always answer any questions that anyone has about any of their numbers. We refer all that information to their primary care physician, offer them any resources that they may need if they're concerned about any of their numbers, whether they need to meet with a heart doctor or somebody else. But we can send them home with all their information that day, and it's free, and you're eligible to do it each year, so they can keep coming back to compare their numbers, which is a really neat thing about the program.
That's a really great thing about the program. And this is really a program for women who do not have an established relationship with a cardiologist already, correct?
Yes. Unfortunately, if you're already seeing a cardiologist, these screenings probably won't be relevant to you. Not that it would be a waste of your time, but if you're already seeing a doctor who's treating you for some of these symptoms, it would be best suited for someone who hasn't already seen someone and is going to learn more about heart disease and then what the likelihood of them developing that would be.
Okay, let's shift gears a little bit and get into your expertise.
Okay.
As I mentioned to you, as soon as we're done taping here, I'm jumping into my gym clothes, I'm heading off to exercise.
That's excellent.
So let's talk about the importance of exercise and good heart health.
Sure, absolutely. Exercise is one of the main things that we talk about when we identify risk factors for heart disease. Sedentary lifestyle is something that you're going to see quite often. So by doing exercise, you're eliminating that sedentary lifestyle. We're eliminating that risk factor for heart disease. And exercise has some very physical responses within your body that are going to help control other things related to heart disease, such as blood pressure, blood glucose levels, so anything related to diabetes. Exercise is a very natural way to help fix some of those numbers if you're having too high results, and that it helps decrease those risk factors for heart disease.
Sure, and it's really good to get you off some of the meds that you're on as well, right?
It is. A lot of times we hear from patients, we're tracking blood pressures, we're looking at the trends, we see where they may be started, we know what dosage of medication they're on, and I think the goal for a lot of our patients and a lot of the people we see is to not take as many medications or not take any if they have that opportunity. And a lot of times the doctor says, you have some lifestyle changes that you can make that very well could get you off this medication. And a lot of times it does come down to exercise.
Sure. I know this is going to probably be different for everybody based upon their individual needs and where they are in a fitness program currently, but what is a recommended amount of exercise that someone should be doing on a weekly basis?
Sure. We do a lot of our exercise prescription based on what the American College of Sports Medicine recommends. And they actually break down their exercise recommendations into 3 different types of exercise. So we look at cardiovascular exercise, strength training exercises, and then flexibility or stretching as a type of exercise as well. And they actually recommend 3 to 5 days of cardiovascular exercise a week for a 30 to 60 minute duration. So that's anything that's going to get your heart rate up for an extended period of time. Walking, jogging, biking outside, stationary bike, swimming in the summer, aerobics dance class. There's a tons of things that you can do. The nice thing is, because that is such a large time commitment, that 30 to 60 minutes most days of the week, we have found that you can break it into smaller time segments and still get the same cardiovascular benefits. So whether it's a 10 or 15 minute walk a couple times a day, you're still really giving yourself those benefits. Strength training exercises, we only recommend about 2 to 3 times a week, so it's less of a time commitment. We do always like to make note that we don't want you to work the same muscle groups on consecutive days. So if you do something involving those upper body muscle groups, you can go ahead and do strength training the next day, but maybe focus on core or the lower body. Let those muscles take time to repair themselves. And then as far as stretching, we encourage that about 3 to 5 times a week. Personally, I always encourage stretching before and after you're going to do any type of regular exercise, whether it be cardiovascular or strength training. And it really doesn't hurt, even on a day off when you don't get any kind of regular exercise, spend 10 to 15 minutes stretching. Really helps increase that range of motion, and as we get older, that's going to decrease our risk of falling, which is something we're always concerned with.
Yeah, absolutely. Can I talk about the importance of walking too?
Sure.
Some of us, myself included, I'm not the type of guy who's going to jump on a treadmill and run for
Yes,
an hour
absolutely.
or run for 30 minutes, but there's great benefit in just getting out and walking.
That's excellent.
You know, on a warm day, just walking the neighborhood, or on a cold day like today, getting into the gym and doing something, right?
Yeah, absolutely. Walking is wonderful. It's one of the best things that we can do for ourselves because it helps with a whole host of things. Walking is particularly good for someone who may have joint or knee problems as we get older. Arthritis becomes an issue, so we may be feeling some pains in certain areas of our body, and we certainly don't want to make that worse. So walking is sort of a less impact way to exercise, but also walking can help with things like osteoporosis. It's a good weight-bearing exercise, so you're maintaining your own body weight, which helps increase or maintain your bone density at least.
Terrific. Let's say somebody's watching this show, they've never exercised, but now they want to do it.
Sure.
How do you get going? How do you start an exercise program and to do it safely?
Sure. Well, first and foremost, we tell everybody it's good to go talk to your primary care physician and figure out if it's safe for you to exercise. Not every exercise program is suited for everybody, and we of course want you to be safe and make sure that you're healthy enough to exercise. And once you've kind of crossed that bridge and you realize it's okay to exercise, my first bit of advice is to start slow. Of course, we know our recommendations from the American College of Sports Medicine, but that doesn't mean you should necessarily jump right off the bat into 5 days of exercise.
Sure.
If it's not something you've ever done before, or maybe it's been quite some time before you've exercised, you definitely want to build on a slower and smaller program and let your body adapt to that new lifestyle change while increasing your exercise.
Okay, so I'm out, I'm doing this, I'm walking the neighborhood, I'm in the gym, I'm really going well for the first couple of weeks, then I miss a day. Then I miss a couple of days. And before you know it, it's been a couple of weeks since I've exercised or since I've been in the gym. How do you keep motivated to stay with an exercise program?
I think that's the hardest question for all of us. I'm definitely someone who has had a hard time in the past keeping with a regular exercise program. First and foremost, don't beat yourself up over it. If you're going to miss a day, that's fine. If you're going to miss 2 days, that's okay too. It's not the end of the world. The worst thing is that it really does take several weeks, more like a month, to build something into your normal routine. So just doing it a couple times for a couple weeks really isn't enough to get your body adapted to make it feel like something part of your daily routine. But again, going back to not starting out doing 5 days a week, you do want to start down with a smaller program. So if you just work for the first few weeks, maybe even the first month, just 3 times a week. 3 times a week is okay. You don't need to go every day. Once we've crossed that first month, now maybe talk about increasing another day, adding another day into it. But don't beat yourself up if you can't get in there every day. We definitely still need to give our body time to adapt, and it will, but we just need to stick with it. It takes a few weeks, like I said, maybe even a month to build something into a normal routine, and then it'll be something that you kind of crave and your body responds to, and you'll want to be there.
Are there some bad habits that we should all avoid if we're starting an exercise program too?
The one that I think I see the most, and I see this with my patients and other people alike, is that once we start exercising, we're spending a couple days in the gym, definitely doing more than we used to do. So we start to think, okay, I've exercised, and we get very focused on the amount of calories that we burn, because a lot of our equipment tells us based on our height and our weight and our intensities how much calories we've burned. So we think, okay, I've worked out and I burned 400 calories and I can eat whatever I want because I've done my exercise, so I can reward myself with food. And I'm guilty of it too. But it's really, really important when you start exercising and increasing your physical activity to nourish your body and help replace some of the things that your body has used during that new exercise. And there are good, healthy food choices for carbs, for fats, and for proteins. And it's very important to go through and make healthy life choices as far as food to supplement what you've used during that exercise. So I'd say the worst habit I see is using the exercise as an excuse to eat poorly, but you really need to have both together to make a healthier lifestyle change.
And that really does speak to the importance of nutritional counseling as well.
Absolutely, yes.
How about the lame excuses for not exercising? And I'm sure you've probably heard millions of them. There are legitimate reasons why some people can't exercise. I get that.
There absolutely is.
But tell me some of the real good ones that you've heard, and what do you say to those people who come up with those ridiculously, incredibly unbelievable excuses why they can't exercise?
Well, I think the first thing I tell them is there's nothing that you can tell me that I haven't already tried myself. I've already used all these excuses as a way to convince myself why it's okay not to exercise, why it's okay not to eat healthy, and we've all done it. And it's not that their excuses are funny, they are relevant, but there are ways around them for anyone who wants to. And probably the first excuse I hear is I don't have enough time. When we first hear those ACSM guidelines for exercise recommendations, we think, I'm already working a full-time job, or I have a house full of children who need to go to school, I'm busy, I don't have time to exercise. And my retaliation or rebuttal for that, if you will, is just to make exercise time for yourself. And it doesn't have to be a long period of time. 30 minutes a day really can do it. And like I said, you can break it up into those 10 to 15 minute segments. I particularly am not a morning person, but I know several people are out there. And if you can get up in the morning and get it done before the rest of the world has kind of started to get up and hustle and bustle, so if it's before you go to work, before you're taking the kids to school, if you can already knock out that exercise, it's a great jump start to your day. Another thing I like to encourage, especially for those of us who have jobs that keep us sitting at a desk all day, is to really utilize your lunch break and that time to use it for yourself. Step away from your desk, from your job, try and put the phone down, whether it's work emails or personal emails, leave it behind, try and set aside 15-20 minutes for yourself just to get a little bit of exercise in. Another excuse that I usually hear is revolved around money, which I completely understand. Everyone has their own financial responsibilities, which are very important. The nice thing is now that gyms have become affordable. They didn't used to be. It used to be very expensive and long-term contracts. So for someone who starts an exercise program and then doesn't follow through with it, they're locked in on a year contract, and that really can kind of leave a negative feeling towards that facility or towards any gym. The nice thing now, there are $10 gym memberships, but even more than that are videos and workouts that you can do at home in your own living room, and there's no one in the world that can tell you that you can't exercise in your living room or take a walk down your street in your own neighborhood. And those things are essentially free of cost. There are resources now on the internet, and I don't suggest just going to any website, but there are several workout videos that you can just log on to or stream online that don't cost a lot of money. And I would say probably the third excuse that I hear is because we talk about exercise and how it decreases risk factors for heart disease. But for someone who is in their 20s, their 30s, even their 40s, they're not sick yet, they're feeling completely healthy. Why do I have to do this now? I feel fine. And my response to that would just be, if you could do something now that might prevent that later down the line, wouldn't you want to give it a try? If it can prolong your life, it can give you a better quality of life, wouldn't you want to engage in that now? So.
Absolutely. You mentioned something as well, and let me touch on this for just a moment. Those of us who have desk jobs and are seated most of the day, there are still some great low-impact, easy aerobic type things that we can do at our desks when we get a couple of moments, right?
Absolutely. There really is. And one of the things I encourage most, A lot of us don't have a lot of space in our desk. My office is more like a closet, so I know what it's like not to have space. But one of the great things that you can do, you don't need to lug a lot of equipment in. There are things like resistance bands that you can put around your feet, under your desk, lightweight dumbbells, and I really am talking 1, 3, 5-pound dumbbells. They don't take up a lot of space. There's something you can slide in a desk drawer, and there's something that you can use. If you're on the phone with one hand, you can certainly be doing a dumbbell curl on the other, and there's nobody that knows the wiser unless you're on a conference call through Skype or something like that. Maybe
Right.
I wouldn't do that. But even not using equipment, stretching is just something that you can do. It's something I find myself doing all the time. I'm sitting at my desk, my posture is poor, and I start to feel a weird pain in my lower back and maybe even my hamstring, and I think, okay, I've probably been sitting poorly for quite some time now, and I actually can't even tell you how long it may have been. So I get up, I take just a couple minutes to loosen up, stretch out those hamstrings, stretch out your back, and I sit down and I feel much better. And then I'm a little bit more aware of my posture the next time. So they're just small things you can do right at your own desk that don't take a lot of time.
Sure, quick, easy, right?
Yes, quick and easy and pretty discreet.
One thing, as we wrap the show up, Caroline, one thing that you'd like people to take away from this show and remember about heart disease, exercise, whatever.
Sure, absolutely. I mean, we've touched on risk factors for heart disease. We've seen how exercise can clearly benefit that. We're going to lower our blood pressure. We can lower our cholesterol, lower our blood sugars. But one of the great things about exercise that we haven't touched on is what it can do for your mood, what it can do for your stress level. Life is stressful. It's always probably going to be that way, and exercise really does have a wonderful way of alleviating that. I mean, it does have a physical response in your body. It releases these endorphins, making you feel happier, less stressed, and overall healthier. And tying that all together, it really is, it's all positive changes and positive lifestyle things that you can do for yourself that not only help decrease risk factors for other diseases, even things such as cancers, risk of stroke, things that we haven't even talked about here. It helps with those risk factors as well. If we can decrease those, overall de-stress ourselves and make us happier people overall, we really should engage in more physical activity.
Absolutely. If people would like to know more about the Women's Heart Program at PRMC, how can they contact you?
Sure, absolutely. You can either go to the website at www.peninsula.org and click on the Guerreri Heart and Vascular link, or you can call my office directly and ask any questions or sign up for an appointment. And that phone number is 410-543-7028, and you can call at any time.
Cool. Caroline, thanks so much.
Thank you.
Love to have you back on the show again if you'll come back, and
I will.
We'll talk a little bit more about stroke and the other things that we didn't touch on.
Sure, absolutely.
Great. Thanks for being here.
Thank you.
And thank you as well for joining us here on LifeWorks PRMC. As Caroline mentioned, there's great information out on our website at www.peninsula.org. Click on the Guerreri Vascular Heart and Institute link, and you'll be able to learn a whole lot more about women and heart disease and about heart disease in general, and about the great things that are going on at Peninsula Regional Medical Center and how we are working hard to make sure that you have a much healthier lifestyle. We're also looking, as we said, for great story topics for this show. So call me at PRMC at 410-543-7142, or you can email me at roger.fallabout@peninsula.org if you've got a great idea for this LifeWorks PRMC show. We'd love to hear from you. Until we see you again, take care of yourselves and your loved ones, and we'll talk to you soon.